All right, welcome to this week's Team Kentucky Update. This past year, really the past 2 years, have brought so many challenges for so many of us across the Commonwealth, but it has also brought incredible economic momentum. As I've said before, we have arrived. No longer a flyover state, we are the destination. In fact, after a record-breaking economic development year last year, where we broke the all-time record for private investment and new jobs, I'm here to tell you that this January and the economic development announcements we are making today exceed January from last year and part of that record-breaking year. So yes, the challenges of our present, they are difficult, but the excitement and optimism of our future is really special. Today, we're announcing $160.9 million in new investments that'll create more than 1,000 new high-quality jobs for Kentuckians. The announcements reach across the Commonwealth and across multiple key industries. Among those is 80 Acres Farms, which is investing $74 million to establish a vertical farming operation in Boone County. The 200,000 square foot facility on more than 22 acres will serve the local market with plans to be operational by the third quarter of this year. I've emphasized the importance of agritech in our state's continued growth, and we now have another incredible agritech company locating a facility right here in Kentucky. Even better, it's going to create 125 high-wage jobs in northern Kentucky. The company's indoor farms use 100% renewable energy without using pesticides, producing salad blends, microgreens, tomatoes, basils, and cucumbers, with plans to add strawberry production in the near future. 80 Acres maintains 8 locations currently, and its flagship farm in Hamilton, Ohio, has the capacity to grow 10 million servings of produce annually. This new Northern Kentucky facility will build on the company's current production capacity, producing greens, berries, and tomatoes year-round in a controlled environment. This high-tech indoor vertical farming operation will include harvesting, packaging, and distribution capabilities and positions the company for long-term growth. So today, I'm joined by Jed Portman and Becca Haters from 80 Acres Farm. I'd like to invite them up here to say a few words. And let me say, thank you for picking us. We're going to make sure that this is an incredibly successful facility.
Well, thank you, Governor. We're excited to be crossing the river into Kentucky, building our first major production farm outside Ohio. Our Boone County facility will be our largest and most sophisticated yet, more than doubling our total output. Our $74 million investment, as you mentioned, will bring fresh, healthy, nutritious produce and more than 125 jobs long-term to Kentucky. It'll allow us to grow closer to our existing retail stores in and around Lexington and Louisville, and to reach new audiences in Kentucky and beyond. We want to thank Team Kentucky for all the support, and we look forward to welcoming you into our Boone County facility when we're growing by the end of this year. Thank you very much.
Thank you.
Thank you.
Thank you. We are really excited, again, to welcome 80 Acres to a large agritech family here in Kentucky. I've already been talking about all the possibilities and how we work together and grow both your company, your produce, and your presence in Kentucky. Next is Confluent Health, which is relocating and expanding its headquarters in Louisville with approximately $10 million new investment. Kentucky's healthcare sector has shown steady growth, particularly in the Louisville area. This commitment by Confluent Health, this is pretty great, is going to create 350 new well-paying jobs in Jefferson County, building on their previous success. We have all seen the importance of healthcare providers during this pandemic. It is great to see another strong Kentucky healthcare company grow in our state and create quality job opportunities for our families. And this project represents significant growth for the company itself, more than doubling its existing office space and building on its current employment of about 123 people in Louisville. I want to thank the leaders at Confluent Health who continue to show their faith in the Kentucky workforce. I know in the coming weeks we're going to be having a groundbreaking and announcement there in Louisville, but 350 good paying jobs in the healthcare sector for a company more than doubling its size is a great sign both for Confluent Health and for Kentucky. That's not all. Today, we're highlighting the growth of a company that already employs over 19,000 people in Kentucky. Kroger is moving forward with plans to locate a e-commerce facility in Louisville. It's going to create 161 new quality jobs and allow the company to expand its fresh grocery delivery capabilities. The 50,000 square foot facility will support Kroger's fulfillment center in Monroe, Ohio, and increase availability of fresh, affordable food for customers around the region. Operations are expected to begin later this year, and the company will soon be looking for delivery van drivers to support the new location. Kroger has been a great corporate partner here in Kentucky, from everything from helping us with COVID testing to COVID vaccinations, to working with us on the Everybody Counts initiative, trying in our pilot program in Jefferson County to get every single graduating senior either in higher education or directly in a job. I want to thank Rodney McMullen, the CEO of Kroger, who's a friend to Kentucky and a friend to me, as well as Ann Reed, who's the Louisville region head, who has been incredible to work with, whether it is on this or even the Shop and Share program they do to support victims of domestic violence. We appreciate Kroger and everything they do in our communities. Next, a major driver behind our recent economic growth has been the automotive industry, especially as it pivots towards the electric vehicle future. And that continues with today's announcements. Piston Automotive, LLC, is a provider of automotive assemblies, including for advanced electric and hybrid vehicle battery systems. Not only is the company expanding in Louisville, it's building on a previously announced expansion to create even more jobs for Kentuckians. In 2019, Piston made public its plans to expand its Jefferson County facility with a $1.5 million investment that would create 50 new jobs. That alone was tremendous news. But the company is now thinking even bigger, increasing the scope of the project to over $26.3 million, investing in a larger facility. Better yet, the company now is going to create 117 new jobs, creating more than twice as many great opportunities as originally planned. I anticipate this growth is just the beginning because our auto sector is truly on fire. Exciting to see all the opportunities, and this is just the start of what we'll see in this sector this year. So thank you to leadership at Piston Automotive for keeping this great project in Kentucky and for helping to build on our automotive sector. Finally, we have the Levi Strauss and Company, which is making a significant investment to increase its distribution presence in northern Kentucky. One of the world's leading clothing brands, the company already operates 2 distribution facilities in Hebron, where it employs approximately 300 people. Today, we're announcing the company's going to add another 300 jobs with a over $48 million investment to establish a new e-commerce distribution center in Erlanger. The more than 575,000 square foot facility will boost the company's e-commerce business to improve distribution capabilities for customers throughout the eastern U.S. Again, these are quality job opportunities, just like they make quality jeans and other pieces of clothing. So we thank this great company for everything it is doing to invest in our people. And to all these companies, we will not let you down. These are such great announcements. Again, since I've been governor, we've broken every record on the books for economic development. But in the time that I've been governor, we've never had a January quite this good. $160.9 million in new investment, as well as 1,003 new high-quality jobs for Kentuckians announced just today. We've had some other announcements already in this month, and who knows, there are a couple more days, so there may be even more. We're continuing to make great progress. And as these announcements show, as our records last year show, we have one of the best business climates in the country. In fact, we were ranked 7th overall in Site Selection Magazine's annual business climate rankings just a month or so ago. They ranked us 3rd nationally last year, that was for 2020 for new projects per capita. And again, fifth in their Prosperity Cup rankings, looking again at business climate. Listen, we are a leader. Let's make sure with all the success that we've had that we keep things going. We don't knock this train off the tracks, and we continue to provide great opportunities for Kentuckians. Okay, earlier today, we announced our next step in caring for those families devastated by the December tornadoes in Western Kentucky. Today, we announced 200 camper travel trailers have been purchased from various RV dealers across Kentucky. These 200 travel trailers will provide much-needed medium-term housing for our people. They've been in hotels. They've been in lodges in our state parks. This is going to get them into something larger, a little more room, a lot more privacy. We're going to have locations where we're going to set up a number of these. We're also going to be able to place them when safe and appropriate at people's property where they are rebuilding. Additional focus, our initial focus will be on families with school-aged children. Make sure we can get them in the school district. And then we're going to look at folks with small kids, elderly parents, work needs. And the exciting part is we're going to hand out the first keys tomorrow morning. 20 of these campers are going to be move-in ready by tomorrow. 10 will be at the Mayfield Mobile Home Community, and that's when we'll be there at, and then 10 at the Penny Rowell Forest State Resort Park Campground, which is about 6 miles from Dawson Springs. I'll be there in person to hand out some of the first sets of keys to these special families. Again, around 200 have been acquired. They're all new. They're either 2022 or 2021 models. They range from about 27 feet to 36 feet long. They are clean, they are modern, and they will ensure that we don't have abandoned trailer parks or medium-term housing when this is done. The resale market on these is high, meaning when we get people back in their homes, we can get these sold and ultimately not have what we've seen at so many other disaster recovery sites. Also, an update on debris removal. We are now at 30% of the overall estimated debris that has been removed from these communities. When we look at Graves County, hit the hardest, requiring demolition, and others, they're at about 10%, but this is the first time they've hit double digits. It's about 43% for all of the communities outside of Graves. I do want to remind people that the deadline to apply for FEMA disaster assistance is Friday, February 11th. You need to apply. If you want help from the Team Western Kentucky Tornado Relief Fund, you need to apply through FEMA. We're able to use their validation system to know that the families we're helping were truly harmed and to what degree. You can go online, you can use the mobile app, or you can call them. A quick update on Kentucky State Parks. We still have 352 displaced individuals staying there, 58 first responders. We're working with the American Red Cross and with FEMA on that. We still need volunteers. So if you're interested, please contact Andy Kasitz at the bottom of your screen. Couple of quick COVID updates. First, hospitalization is near a record high. We are close to the height of inpatient census that we hit in the Delta variant surge. Yes, Omicron is less deadly, but a heck of a lot more people have it, meaning that there still are a significant number of people getting really, really sick. As of yesterday, we had less than 100 adult ICU beds available in the state that can be staffed. This thing is spread so aggressively. We have a lot of staff that's also out from our hospitals. That's why we have over 440 National Guardsmen in our hospitals right now. Folks, be careful. When this happens, we don't have room or beds for people hurt in car accidents or who have strokes. The danger here is bigger than just COVID. So even if you are still a skeptic that this thing can hurt and or kill you, please do the right things so that others harmed in different ways can get the care they need. Also, just wanted to provide a quick update on our overall death toll. It is difficult. It is astounding. As of today, this is before today's report, we've lost 12,817 Kentuckians. Again, more than I think in any 3 wars in our history put together. And that's in 20 months. And that's not including all the people that we've lost to other things during this period of time. I don't know about y'all, but I have lost, whether to COVID or to others, so many people over the last couple years. And I just hope, even as tired as we are, that we take a minute and realize people are losing people very close to them. And that ought to give us the strength to continue and to push through. In fact, as we look at our numbers, we've now lost over 2,000 Kentuckians under the age of 60 to COVID. That, again, is an astounding level of loss of people that young. Let's look up at the age and vaccination status of COVID-19 deaths. I want to impress on everybody again that certainly if you are under the age of 50, statistically, you do not die from COVID if you were vaccinated. But this is killing a lot of people who aren't vaccinated at ages that typically would not die from a virus. If you look under 60, again, it is almost exclusively unvaccinated people that are dying from this virus. A virus that has killed more Kentuckians than any 3 wars we've ever been in put together. You can completely protect yourself from if you are under the age of 60 or really even under the age of 70 and you're just willing to get vaccinated and boosted. These numbers tell the entire tale. If you get vaccinated, you need to still be careful, but you are well protected. If you are not, this thing is the deadliest thing that we've seen, certainly in my lifetime or all of our lifetimes. And I just want to show the age distribution charts, which we've shown. 10% of all deaths that have occurred since June, right? Since June, and this is when everybody should have gotten fully vaccinated, are in people ages 30 to 49, right? And we just saw that you don't die from COVID if you're vaccinated and you're in that age group. And look at that. That's increasing from 2% to 10%. And the reason that this shift has occurred are the people willing to get vaccinated. I mean, look, the 70 plus has shifted from 3/4 to half, even though they're the people most at risk, because they're also the most vaccinated categories of people. Much less so from 50 to 69, though that's certainly picked up. So, every day when we read the report, we talk about people in their 20s, in their 30s, and in their 40s. COVID-19 right now is killing younger people at a higher rate, certainly, than we saw even initially in the pandemic, and that's before we had vaccines. So, again, get vaccinated, protect yourself. We don't want to lose any more Kentuckians. With that, we will open it up for questions. We'll start with the 2 journalists that are here. We'll start with Michael.
If I may,
Yep.
question. How's your son doing?
He's doing great. My son, Will, is perfectly healthy. He is, we miss being as close to him as we'd like to be, but we're coming up on being able to do that again. Karen?
Governor, is there any other information you'd like to share on the journey your family's been through to share with other families going through this? And are we still utilizing nursing students at this point?
The nursing student relationship is now direct with the hospitals, and the hospitals reach out to them when they are in need. Certainly our nursing programs have been amazing. Galen was one at the forefront of this. Not only did they volunteer huge numbers of students, their nursing students did a really good job, as did others. Our journey this week, first, I'm grateful and we're blessed that we have vaccines. Now, other than some sniffles, my son hasn't experienced any symptoms. I mean, the first day he had a few sniffles. He didn't even have those on day 2. And we know he's going to be just fine. We appreciate all his teachers and his school system in providing him the tools to stay up to date. He's actually doing really well in school this week, which is neat to see. But not being able to hug your kid every day is hard. Is really hard, both for him and for his mom and dad, and for his sister too. Though it'd be wonderful to see them hug when he doesn't have COVID every now and then. But I'd just say to the families out there, first, thank you for doing the right thing when someone in the family gets COVID. To those that haven't had to go through it, you really don't want to. Even if everybody's going to be okay, it's just not easy.
Governor, are you equal parts concerned, but maybe somewhat relieved that so many schools are going to NTI right now? Relieved because it could help the transmission rate a little bit?
Well, question is on schools and NTI. I want every school to be in person every single day. I think the number of schools going into NTI first show us that we are at the highest level of transmission of COVID ever. And most of them can't avoid it. But second, I really think it shows how critical masking is when you put that many people together. And as a percentage, they're not nearly the highest vaccinated nor close to the most highly vaccinated groups. So I hope as people come back that they will adopt the universal masking between that and test to stay. Certainly my children's school hasn't had to use one NTI day yet. So, I want everybody to be safe, but I want our kids to be in school. I think we can even now. Now, we do hope and we do think that Omicron is cresting, that this week will be either close to last week or just barely ahead as we're here, or maybe we'll start seeing the dip. But if we follow the trends that others are, if this week is higher than last week, then next week we truly believe will be lower. Now, even if it's lower, it's still going to be too high. So we got to ride the dip a couple weeks, but we hope that it descends as fast as it ascended. Tom Latek.
Thank you, Governor. Good afternoon. Glad to hear the news about Will, and I guess the rest of the family still testing negative, I would hope.
Yes, sir.
Good. The rest of the, you mentioned that 20 of the travel trailers or RVs are going to be distributed tomorrow. What's the schedule for the remaining 180?
So it'll be a work in progress. That's both as we find families that are going to qualify as well as locations. I believe we have room in the Mayfield site for 30 plus travel trailers, meaning the utility hookups are already there and they'd be good to go once we hook them up. That's just that location. Penny Ryle has, I think, even up to 40 more, though we'll have to do a little bit of work getting, I think, to the top of that number and beyond. We're in Bremen today. Transportation is looking at what our options are there as well. So we got a lot of locations to hit. We've got to make sure that we can do the proper hookups and that they're at safe locations. I expect that we'll more than double what we're doing tomorrow in the course of next week. But again, there's both placement of the travel trailers themselves and placement of the families inside them. Bria Jones.
Hi, Governor. With the rollout from the federal government of both KN95 masks and the free at-home tests in areas affected by the tornadoes, how are we seeing those rollouts happen here when people don't have those addresses to send the COVID test to, and some of those pharmacies and community partners where the masks aren't built back up or reestablished?
Oh, that's a good question. Certainly, we've been distributing masks at both our state parks, and they've been made available at hotels and other non-congregate sheltering. But it's a good question that let me look into, because those pharmacies which are now just receiving those masks. I think they hit the major urban areas first. But it is a good question, and we need to assure that KN95s are available in every part of the state for those being willing to wear them. Debbie Yetter from the Courier-Journal.
Hi, Governor. Do you have any projections on hospitalizations? Even with COVID beginning to crest, the numbers are still getting up pretty high, close to where they were in September with Delta.
Right. We don't have a predictive model at the moment. People's experience even in the hospital with Omicron is different than in Delta, both where it hits you and the severity. For instance, our ventilator use hasn't gone up as fast as the inpatient census and as the ICU has. Certainly the hospitalizations, you're right, Debbie, are going to trail by a couple weeks, right? They should keep going up as cases go down. Also, though, remember, our ability to help people depends on the staff too. So it could be that we even have more people coming in, but we have more staff recovered that are coming back. As we talk to our hospitals, what we're hearing is they know where we are, hoping that we're about to peak, and everybody is committed to pushing through it. There aren't a whole lot of options out there other than the guard and the nursing programs to continue to provide help. Stan Ingold from WEKU.
Yeah, good afternoon, Governor. Earlier this week, talking about infrastructure, your office announced $13.5 million for highway projects in Eastern Kentucky. Could you talk a little bit about how this money is going to be used and how it's expected to improve conditions in the area?
All right, so this was an additional award under the Federal Infrastructure Act for Appalachian rural roads. So all of these dollars will go to our Eastern Kentucky roads. And there's going to be some guidelines from the federal government that are forthcoming. The federal government typically sends you the money and then gives you the limitations on how to spend it. But our transportation cabinet is working through that right now. My strong preferences are going to be based on safety. We're in the top 10 for the most dangerous rural roads in America. We lose far too many of our family members on them. So my priority on that $13+ million, again, with whatever guardrails the federal government puts in place, is where can we make the biggest and the most impact from a safety standpoint. Now that's going to be obviously just one piece of all the infrastructure we're spending on right now. The Infrastructure Act adds on top of what is already a healthy transportation cabinet budget this year. I think it's more than $170 million more in roads and bridges that we'll be able to do because of the Infrastructure Act even before these dollars. So we've got to take, in a broader sense, the general fund dollars, the transportation dollars, the ARPA money, and the Infrastructure Act dollars, as well as anything else coming in. And ultimately, we have one spending plan on how to better protect and serve our people with that. But listen, it's exciting news. It's going to make for safer roads for the people of Eastern Kentucky. Al Cross, Kentucky Health News.
Thank you, Governor. A couple of questions about the trailers. Is there not a 6-month limit on these? And what happens if these people haven't found permanent housing? Are they going to get evicted, or can they rent the trailers, or what? And what's going to be done to storm-proof these trailers in the tornado season?
So the travel trailer program is one where every month you've got to provide your certification. There's case management services. How are you doing? How can we look to try to find you more permanent residents, which we want to do as we go. The program lasts for 6 months under FEMA guidelines, but we can also move to re-up it for 6 months after the initial period. If after 6 months we have enough permanent housing there in the community to move people back into, hallelujah. And some of these communities, it may be possible, but certainly on the hardest hit ones, I fully expect that we're going to have to ask after the first 6 months to re-up for another 6 months. We don't anticipate having to evict individuals regularly as we go. Now, in all of these programs, we see two things. Number one, you regularly do your due diligence, and sometimes you have folks that weren't directly impacted by the storms. And so, that's an action you have to take. The other piece is once there is permanent housing back, sometimes people don't want to leave the medium term or temporary housing. And so at the very end, there's a challenge as well. On the stormproof side, that's part of the locations that we are scouting out. The Transportation Cabinet has that as a piece of how they decide where some of these locations go. The other thing we are doing is locating a shelter that is at or around that we would direct these individuals and the surrounding community to go to. It may be a school, it may be another type of building, and we're going to have to work to make sure that it is open and available for them when we're going to have severe weather. But the Transportation Cabinet, working with emergency management, is doing a really good job in trying to find the best and the safest locations for these. All right, that is the end of our update today. Remember, Omicron is just surging through Kentucky. We hope we are at the peak, but that means it's one of the most dangerous times in terms of catching the virus. So protect yourself. If you get fully vaccinated and boosted, you're going to be just fine if you get it. If you don't, you're really taking a major risk. Thank y'all.